Welcome to Doctors on Call. I'm Jenna Miller. Nearly every week, our medical experts emphasize the importance of quitting smoking or never smoking at all for combating disease and illnesses of all kinds. But did you know that cigarette smoke has been found to be the leading cause of lymphoma in house pets? Furthermore, pets have been found to be just as important in the household as the humans living there. A recent study shows that 50% of pet owners give their furry loved ones a Christmas stocking, and 13% actually carry a photo of their pet in their wallet. So how can you assure you give your pet the best life they deserve? Joining us tonight to answer that question and others will be veterinarian Dr. Brandon Weidenhaft.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Closer Regional Hospital, experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Dr. Brandon Weidenhaft graduated from Kansas State University College of Veterinary Medicine in 2001. Having grown up in western Kansas, Dr. Weidenhaft was excited to return to the area and has been practicing in Hays for the last 12 years. On September 1st, 2012, he opened his own mixed animal practice, Big Creek Veterinary Services. Doctors on Call brings you information which may be useful to you when you see your own physician or veterinarian. Thank you so much for joining us again this year. We're excited to see what kind of calls and questions we get today. First of all, in the open, we were talking about the dangers of secondhand smoke with pets. Well, what's your take on that?
The lymphoma thing was kind of a little bit of a surprise to me. I didn't realize it was that high on the list. But we see a lot of respiratory and allergy issues that come from secondhand smoke. So that is a combat that we deal with frequently, and more skin and itching and that issue that comes with it. So I guess maybe haven't noticed the increase in the cancer from secondhand smoke, but definitely skin-related issues.
Sure. So what kind of advice would you give to somebody besides, encouraging them to quit?
Sure.
What else can you do to help combat that?
It'd be the same as if you have children in the house or, other loved ones in the house would be, try to take it outside take your smoking outside, try to eliminate the exposure to the pet. People may not realize the effect that it can have on your pet, but the same sort of thing you would do if you had children in the house would be the same for your pets.
Absolutely. Let's talk about your practice and if a person's never been, what they can expect maybe if they bring a pet for a wellness exam or anything else.
Sure. So we are located on the Bypass Road in Hays, kind of on the west edge of town. I am the only veterinarian currently on staff there. I'm the owner as well. So you'll see me, if you come in for a checkup or vaccinations, so on and so forth. I do the surgeries, I do the vaccinatings. I do have a veterinary technician, Diane Unrein. Her and I have worked together for 23 years. And so some of the routine things like nail trims and stuff like that, sometimes she'll do those. If I'm tied up doing a surgery or something, somebody pops in the door, just sort of a walk-in. Diane's very capable of doing a lot of those procedures like that. So my other staff, Amy and Brenna, my receptionists, they'll greet you at the door as you walk in, check you in, get you prepared for while you're there, and then, full examinations and that sort of thing. We do full examinations with just a vaccination and that sort of thing. So, most of the time, if you come to see us, you're going to see me because I'm the only one there.
Very good. Now, you take both small and large animals?
We do, yep. We are about 50-50 on numbers-wise with our large animal clients and our small animal clients. Try to do mostly small animal in the morning and the large animal after lunch. Especially this time of year with kind of finishing up preg checking and that, and then we're into the heart of calving season, so
Sure.
try to keep our afternoons a little bit available for emergencies and that sort of thing with that. So
Absolutely. Speaking of emergencies, what is the protocol, I guess, if a person has an emergency? Do you have a hotline?
sure. At our clinic, if you call our clinic number at any time during the day, you'll get one of the receptionists. At night, you'll get me. The phones go directly to me at night. We don't use an answering service because I'm the only one. So, yeah, if you have an emergency after 5:30 in the evening or on the weekends or on Sundays, you call the clinic number, you get me. So we do all our own emergency calls. I take all the calls and try to triage them as best as we can, and there we go. So.
Sure. Now, if a person is maybe on the fence, do I call? It's after hours. I hate to bother. Sometimes
Sure,
people
sure.
are leery of doing that. What's your advice to them?
Even if it's just a question, go ahead and call me. I'm happy to answer it. We can discuss it. Maybe it's something that we can get by till tomorrow on. Maybe there's something over the counter that help get you through the evening. And we can. Some things I can kind of, I guess, anticipate what the problem is going to be by the way the conversation is going. And so there's sometimes things that we can do to avoid an emergency call and help them through. And sometimes it truly is an emergency, and we make arrangements and meet at the clinic and figure out what's going on.
Good to know. Puts the person at ease a little bit.
Sure.
We do have an email question that we'd like to discuss. This one's from Julie, and she is asking, she has 3 kittens under the age of 1, and we have litter box trained them. We keep the litter box clean and changed on a regular basis, so it's always ready to use. Lately, the kittens have been going to the bathroom in various parts of the house, and we have disciplined them for it, and yet they still do it. Is there a way to get them to stop using the bathroom everywhere but the litter? Could this be a sign of health issues?
Okay. It may be a sign of a parasite issue, but it may be just they have decided that the litter box is okay, but not necessary. And so there may be benefits to trying like a litter box attractant, which you can add like a good smelling substance, and most of them have catnip in them, to help try to bring them back to the litter box to get them to use it again. One of the things that comes to my mind would be to try changing the litter substrate. Maybe the litter is unappealing to them. And so maybe trying a clumping litter, or if you're using the clumping litter, maybe try and go to one that's more of a clay base that doesn't clump, because there could be something to the litter that they just aren't happy with. And then my other kind of recommendation would be to maybe move the litter box to a small room, like a bathroom or a utility room, and kind of confine them for a little bit and try to influence them to go back to using the litter box. Sometimes if the litter box is in the utility room, but they have full run of the entire house, sometimes they just kind of forget to go back to where the litter box is, and they'll go wherever. So, maybe confining them into a small space, especially during the day while everybody's at work and there's nobody around the house, that might help influence them to get back to their litter training that they've had. So, but the litter attractant seems to work pretty good sometimes, and you just mix it in the litter, and it sort of helps, like a smell that's appealing to them, to get them to come back there.
Sure. Now, cats and dogs are very different. Julie said that they have disciplined their cats. My question is, first of all, how do you discipline a cat?
Right.
And second of all, do you reward them?
You definitely can. There's pet treats that are cat friendly, and our little clinic cats love them. And so as a reward, if they, it's hard to they went in the litter box, we'll give him a treat. And with all pets, it's got to be pretty instantaneous in order for them to correlate either the punishment or the reward with their behavior. Obviously, if they go on the floor and an hour later and you punish them for it, they don't know why they're being punished. It needs to be pretty instantaneous. But yeah, sometimes even with cats, there's treat rewards that would help influence them to go do the right thing.
Sure. Okay. Let's talk about a pet's weight. How do you know if your pet is over or underweight?
Oh, the best thing to do would be to bring him by the clinic and weigh him. One of the things that people get in the habit of is looking at dogs, especially dogs, that are a little bit overweight, and they kind of start thinking, well, that's normal. So sometimes when you get one that is of a healthy weight, they're thinking, oh, that dog is so skinny, but it's actually just fit and in a healthy weight. But, you know, I would say to bring them in and get them weighed and find out what the weight is, and then determine kind of a body condition score from that point. We have people that stop in all the time just to weigh their pets, and you know, we visit with them for a minute and they hop on the scale and kind of determine where they fall, and then you know, we can help make a recommendation on feeding and things of that nature, depending on whether they seem to be at normal weight, underweight, overweight. But I think by and large most of our pets are a little on the heavy side. So
Sure. And why is that?
well, you know, you want to love them, and you know, we want to love them with food, and so I think that they tend to get fed maybe a little extra, and then treats and snacks, and lack of exercise sometimes. You know, they just don't burn off a lot of calories when they spend half their day sleeping on the couch or whatever. At least if they're at my house anyway, that seems to be the going place, is on the couch or on the pet bed behind the chair. So they just don't maybe burn off enough calories, and maybe consume a few too many calories. So.
Sure. And how detrimental can that be to a pet in the long run?
Well, it can lead to heart issues. It can lead to bone and joint issues. And it I think, depends a little bit on, you know, just exactly how overweight they are. A little bit of extra weight, especially in the wintertime, is probably not going to hurt anything. A lot of extra weight year-round can definitely lead to heart issues, and it can lead to arthritic issues and joint and bone pain as well. So.
Sure. And what is your best advice to get that weight off?
So if you have a pet, and the probably the first thing to check on is how much are we feeding per day, and then go by the recommendations of the food that we're feeding. So most pet foods will have a guideline listed on the sack that says feed 1 cup twice a day, or something to that nature. So if it's 1 cup twice a day for a 50-pound dog, and your dog weighs 50 pounds, but really should only weigh 35 pounds, I would recommend feeding them at the level of a 35-pound dog. And for some people, that might be, you know, feeding it considerably less than what they've been in the habit of. And for the first week or two, that dog is going to be hungry quite frequently, because his consumption is going to drop. So you got to be kind of tough love with it to get them to start coming down off their weight.
Sure. Do you recommend small meals or one meal, or how do you?
Typically, I recommend feeding your pet twice a day, morning and evening. And I, you know, most of the time would just try to cut back on the caloric intake for each meal in order to try to decrease their weight just a little bit. And of course, always exercise is good. Not like last week when it was negative degrees outside, exercise is not going to happen. And I agree that it's hard to do when it's that cold. But like this week when the weather's nicer, a walk around the block or 2 trips around the block would help most pets. So
Absolutely. Now let's talk about ways to freshen your pet's breath.
okay.
Seems like that can be a problem.
Sure, absolutely. So, you know, the probably Cadillac approach would be doing a dental under sedation, so that, you know, you can get their mouth open, you can clean their teeth, much like the human scaling. You know, we scale them, we polish them, and that tartar that builds up on the teeth, it's kind of a brown discoloration. That is the place where bacteria likes to live, and that bacteria is what produces the odor. So if your pet has pretty bad breath, it's probably the teeth, not necessarily halitosis like just bad breath, but it's probably bacteria in the mouth that is adhered to the teeth. And so that would be kind of the gold standard would be doing a dental cleaning. You definitely can brush your pet's teeth at home. The success rate on that is a little bit variable, because some pets like it, some pets hate it. And but there are like poultry flavored toothpaste and things of that nature for pets. And there are things like water additives and things like that that will help freshen their breath. If you get on the internet and do a search, you'll find all sorts of food additives and water additives and, you know, powders that you mix in their food that are supposed to clean their teeth while they eat. I don't know if those things work or not. I'm afraid a lot of those are probably fish oil, and or snake oil, that's what I meant. And they're probably really not that beneficial, but I have never tried many of them. But I know there's all kinds of things available online. But really, brushing their teeth, there are water additives that will help with the breath, but those are the best approaches to help with that breath.
Sure, absolutely. And you were talking about the weight as far as the long-term issues with not getting that weight off.
Sure.
What about if you don't take care of those teeth? Is there long-term issues?
Absolutely. So, that can lead to sepsis where the bacteria can enter the blood supply through those dental roots, and that bacteria can then go to other organs and lead to other health issues. It can go to the heart, can go to the kidney, some things of that nature that can lead to other health issues that were a lot more detrimental than, even the initial teeth issues. So,
Absolutely.
and some older pets, we may have to remove some or several teeth, just depending on just the quality of tooth that is there. So,
Absolutely. All right. Well, we want to remind our viewers that we are talking about pet health tonight with Dr. Brandon Weidenhaft. So let's talk about shots and what is recommended for a person's pet.
okay. Kind of the baseline would be for dogs a distemper parvo adenitis hepatitis combination vaccination. A lot of people call it a parvo shot, but there's a lot more to it than just parvo. We give them, it's what's in the puppy shots. We give them at 6, 9, 12, and 16 weeks of age. And then yearly, we booster it. And then that one's every 3 years. And then kind of the baseline would be a rabies vaccination. And we give that at 12 weeks or older. We booster it 1 year from that point, and then every 3 years after that as well. With cats, we give them what's called an FVRCP, which is an acronym for multiple valents that are in it. And we do the same. We do 3 vaccinations at kittens, and booster that one as 1 year of age as well. And then the rabies is the same. We do it at 12 weeks or older, again 1 year, and then every 3 years after that. So there are a few other things like kennel cough vaccine that some dogs that would board or go to a groomer or places like that would need. It's not in our core vaccine, but it's like recommended for pets that go to boarding facilities that are, that sort of thing. There's a kennel cough vaccine for cats as well. Cats, there's also a feline leukemia vaccine. We don't make it mandatory. We leave it as an option at our clinic. And we use a fair amount of it, but not tons of it. So,
Sure.
But, those are vaccines that I leave up to the owner. I don't make them mandatory by any means, but if they have a lifestyle that may require it, that's available there. So
Sure. And what kind of lifestyle would maybe require that?
for the most part, it's going to be people who travel with their pets a lot, or they travel a lot and leave their pets at a boarding facility, that sort of thing.
Sure.
The feline leukemia, a lot of kind of your feral population is going to be cats that are harboring some of those virals, either feline immunodeficiency virus, feline infectious peritonitis, or feline leukemia virus. There is not an FIP or FIV vaccination as of right now, but if you have a cat that likes to go indoor-outdoor, may come into contact with some of those other sort of feral population and things like that, then feline leukemia vaccination might be good for those.
Excellent. Okay, we're going to take it to the phone lines. We've got Kent on the line from Benton. Hi, Kent. Go ahead with your question for Dr. Weidenhaft tonight.
Yeah, I've got a lab, black lab there. It's 8 years old, and he got a ear infection there, and yeast was coming out his eyes there. We took him to the vet and got some medicine, got it cured up, but he's starting to have that trouble again. And I'd like to know what can I do to keep his ears clean? There's something wrong. Had a lot of labs, and this is the first one I've had this trouble.
Sure.
I'd like to know what I can do.
Absolutely. So periodically cleaning those ears. You can get antibiotics from your veterinarian, but you also may ask about an ear flushing solution. And the ear flushing solution will help change the pH of that ear just a little bit and make it just a bit more acidic so that the bacteria can't grow in it as well. And just maybe weekly ear cleaning. Just put a little bit of the flush in the ears, massage it around a little bit, and then use like a cotton ball or a little gauze pad to clean the excess flush out. Might be one of the keys to help keep that ear a little more healthy. And then the periodic antibiotics that you've already picked up may need to be used. We find that sometimes in labs, ear infections can be allergy related. It affects their feet and a lot of times their bellies and their ears. And so maybe a course of an anti-allergen, even something simple like over-the-counter Benadryl might benefit him. And of course, with labs, one of the things is they like to play in the water. And so, like if you take him hunting or if you go to the lake for the weekend, it would be a good idea to flush those ears out and get them dried out a little bit, just to make sure that there's not moisture there, because bacteria in those ears like that moist environment and will help that'll help by cleaning those ears after like a weekend at the lake, help kind of stay off an infection.
Sure. So we were talking earlier about, periodically brushing your dog's teeth. Does a dog need to have their ears cleaned periodically?
Sure. They develop wax and dirt in their ears just like any other animal or person does. So even just routinely at home, flushing them with a little, like even hydrogen peroxide, just put a little bit in there, massage it around for a second, and then wipe it out with a cotton ball or something like that, and help clean those ears. And you'd be surprised that it starts to build up after a while.
Sure. Is there anything a person needs to be cautious of? I know sometimes you like to use the Q-tips and whatnot. Is there
Sure.
danger involved in that?
I tell my clients that the ear canal kind of goes down and in, and so in order to hit like the eardrum, you would have to be really aggressive. So if you can see it, you can swipe it. And so if you look in there and you see some that dark kind of dirt and you take that Q-tip and swipe it out of there, you're not going to hurt anything. I would be cautious about digging deep, but if you can see it, you can swipe it. So.
Sure, absolutely. I wanted to go back a little bit when we were talking about the vaccinations. And what do you find if a person maybe refuses or does not want to give their pet vaccinations? What is the risks that they run into?
From my standpoint, if they don't want to give like a distemper parvo vaccination and it's an older adult dog, their immune system is probably plenty healthy enough that it's not a big deal. By law, if their pet bites somebody and they did not have a rabies shot, then they're going to possibly be faced with quarantine time. And then if you have to have your pet quarantined after the 10-day quarantine, then by law you have to have it vaccinated before you can take it home. So do you have to do it? Not necessarily, but at least the rabies shot I would always recommend just from a public health standpoint.
Sure, absolutely. Let's talk about if a person thinks they have a pet with a broken leg or a broken bone of some kind. Do you do x-rays,
Sure.
MRIs? What do you do with that?
Well, for us, we have x-rays, we have digital x-rays, so take the picture and in 30 or 40 seconds we have an image available on the computer screen. We have bone plates, we have bone pins for fixing broken bones and that nature. So if you think your pet has a broken bone, we take an x-ray to begin with and see what we're looking at and what it's going to take to fix it.
Absolutely. Okay. Well, our thanks goes out again to Dr. Brandon Weidenhaft for being our guest today on Doctors on Call. On our next Doctors on Call, we'll be discussing general health with Dr. Tyrell Summers. You can email questions to us for that next program at doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS. is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.